Has your doctor told you, or someone you care about, that you might need an ICD, an implantable cardioverter defibrillator? It's normal to feel uncertain about what that means. Think of it as a personal guardian standing by 24/7, ready to act when needed. Clinically, ICDs are proven to reduce the risk of sudden cardiac death by detecting and treating dangerous heart rhythms in real time. In this episode, I'll take you through ICD implantation, from preparation and the procedure to recovery and everyday life with the device. Welcome to the Pulse Report. I'm Dr. Shen, a cardiologist specializing in electrophysiology and the Director of Research and Education at Cardiovascular Medicine. By the end of this episode, my goal is to give you and your loved ones a clear, step-by-step picture of the journey so you feel informed, prepared, and reassured. Let's start with what happens before the procedure. Your care team will first take a close look at your medical history, things like your past heart conditions, surgeries, and the medications you take. This helps us confirm that an ICD is the right choice for you and that we plan the procedure as safely as possible. You may also need some tests. These could include blood work, which checks your kidney function, electrolytes, and how well your blood clots, an echocardiogram, which is an ultrasound that shows how your heart is pumping, and sometimes a chest X-ray or CT scan to help guide where the leads will go. One important part to note is your medications. If you're on blood thinners, for example, your doctor may adjust or pause them a few days before the implant. That's to lower the risk of bleeding. The key thing here is to always follow your doctor's instructions. Don't make changes on your own. On the day of your procedure, you'll need to arrive fasting after midnight, meaning no food or drink. This keeps things safer while you're under sedation. Now let's move into the procedure itself. An ICD implantation usually takes 1 to 2 hours. We start with a small incision under your collarbone, usually on the left side. Through that opening, thin wires, called leads, are threaded through a vein into your heart. We guide them carefully using X-ray imaging so we can see their position in real time. Once the leads are in the right spot, they're connected to the ICD generator. This is a small device, about the size of a pocket watch, with a built-in computer and battery. It sits just under the skin in your upper chest. Before closing the incision, we'll test the ICD to make sure it can detect abnormal rhythms and deliver the right treatment. Sometimes that treatment is a quick pacing burst. Other times, if needed, it's a stronger shock. Once we've confirmed everything works properly, we close the incision with stitches or glue and apply a sterile dressing. An ICD implantation usually takes 1 to 2 hours. The exact length can vary depending on your anatomy, the number of leads being placed, and whether any adjustments are needed during the procedure. Once your ICD is in place, you'll spend a few hours in a recovery area. Nurses and doctors will monitor your heart rhythm, blood pressure, oxygen levels, and your incision site. You'll probably feel a little sore at the incision and a bit groggy from the sedation, and that's completely normal. You'll also have a chest X-ray to double-check that the leads are positioned correctly and a device check to make sure the ICD is sensing and responding the way it should. To protect the leads as they heal, you may be given an arm sling to remind you not to raise that arm too much in the first few days. Some patients go home the same day, while others stay overnight for observation. It depends on your individual case and how your recovery is going. Before you leave, your care team will walk you through how to care for your incision, what activities to avoid, and when to come back for your first follow-up visit. Once you're back home, recovery continues. It's common to have mild bruising, swelling, or soreness around the incision. These usually get better within a few days. Keep the site clean and dry. You may shower, but it's best to cover the dressing with a towel and avoid letting water run directly on it. Leave the outer dressing in place until your wound check, which is usually 10 to 14 days after the procedure. For the first 2 to 4 weeks, avoid lifting, pushing, or pulling with the arm on your ICD side. Avoid lifting that arm over your shoulder for now, so the leads have time to settle and heal. That said, walking and light daily activity are safe and encouraged as they help your recovery. At your follow-up visit, Your care team will look at the incision and test your ICD with a programmer to confirm that everything is working as expected. These follow-ups are an essential part of your recovery and long-term care. It's also normal to notice some shoulder discomfort, temporary fatigue, or a small lump under the skin where the generator sits. These improve with time. Now let's talk about what life looks like once you're living with an ICD. Research has shown that ICD are reliable. On average, ICD batteries last about 7 to 12 years. When it's time for a new one, only the generator is replaced and requires a simpler outpatient procedure compared to the first implant. You'll have regular visits in the clinic, and many ICDs now include home monitoring that works 24 hours a day, 7 days a week, through a wireless system that connects automatically. This allows your care team to track how your device is working and spot issues early. After your implant, you'll be given a card with important details about your device. Always carry this card with you. It's essential for emergencies and for travel, especially at airports. If you ever feel a shock, let your care team know right away, even if you're feeling okay afterward. A lot of patients ask about electronics. Here's the reassuring news. Most household electronics are completely safe, things like microwaves, televisions, and normal appliances. But there are a few exceptions. Strong magnets, like those found in big speakers, welding equipment, or industrial machines, can interfere if you're right next to them. The solution is simple. Just don't stand close to or lean against this kind of equipment. As for security gates at airports or stores, it's fine to walk through them normally. Just don't linger or lean against them. And about cell phones, yes, they are safe to use. You can text, talk, and hold them to your ear. The only precaution is to avoid keeping your phone in a pocket directly over your ICD for long periods. Put it in your pants pocket, handbag, or on the opposite side of your chest instead. Once you've healed, you can return to a full and active lifestyle. Traveling is absolutely possible with an ICD. Carry your ID card, your doctor's contact information, and enough medications and supplies for your whole trip. At airports, ask for a hand search instead of a handheld wand. Walking through metal detectors quickly is safe. If you use medical equipment, like a CPAP machine, keep it at least 6 inches away from your ICD. And if you're traveling for more than 2 weeks, remember to bring your remote monitor with you. Complications are rare, but it's important to know the warning signs that need immediate attention. First, let's talk about symptoms related to your heart. Call for help right away if you experience severe chest pain or crushing pressure, shortness of breath that is new or getting worse, or dizziness, fainting, or very slow heartbeats. These can signal problems that need urgent medical attention. Next are signs related to your ICD itself. Contact your care team if you notice a sudden return of old symptoms like fainting or palpitations. And if you ever feel your ICD is delivering repeated shocks, or if you think the device might not be working correctly, don't wait, seek care immediately. Also, keep an eye on your incision. Warning signs include redness, swelling, or drainage that's getting worse, persistent pain that isn't improving over time, or a fever or chills which could signal infection. It's always better to be cautious and reach out to your care team than to wait and risk things getting worse. Finally, let's talk about getting back to your routine. Within 24 hours, most people are walking, eating normally, and doing light household activities. By about 1 week, many patients return to desk work or light duties. It's best to avoid heavy lifting or overhead arm movements for 2 to 4 weeks, but walking and light exercise are safe and encouraged. You may be given short-term antibiotics to protect against infection and pain relievers to help with soreness. Some patients continue or adjust their blood thinner therapy depending on their heart condition. Your ICD will be checked again within 1 to 2 weeks and then at regular intervals. These checkups make sure your device is protecting you the way it's meant to. So that's the ICD procedure in a nutshell. Careful preparation with tests and medication review, a safe 1 to 2 hour procedure to place the leads and generator, a short recovery that's often same day or overnight, some temporary soreness as you heal, and a follow-up check within the first 2 weeks to confirm the device and leads are working as they should. Once healed, most patients return to a full and active life. Stay on top of your checkups and make healthy choices, and your ICD can support you in living an active and safe life. If you found this guide helpful, please share it with loved ones who may be preparing for a pacemaker procedure. And don't forget, you can find a patient-friendly pocket guide linked in the episode notes. Thank you for listening to the Pulse Report. I'm Dr. Shen, and let's keep your heart and your life going strong and in rhythm.